Hello, welcome to Tuesday Talk. It's Rebecca Kelly, nurse practitioner at AIYANA Aesthetics. And today I wanted to talk about some signs that you might be having that you need to think about bioidentical hormone replacement therapy. So BHRT, or bioidentical hormone replacement therapy, is something we do offer here at AIYANA, and it's honestly one of my favorite treatments. We talk a lot about all the things that we can do to help our face and our neck and our body, but what about the inside? And that was really something that I wanted to make sure I did not neglect when I opened this practice, because honestly, optimizing the inside is probably more important than optimizing the outside. So I wanted to give you guys some information about BHRT and how it can certainly be something that can improve your life. And I truly stand behind that statement. So what exactly is bioidentical hormone replacement therapy? So when we talk about BHRT, we think about the hormones that are inside our body, which we have a lot of hormones, but the main ones that you hear a lot of are testosterone, estrogen, vitamin D, thyroid. Those are all hormones. So we want to optimize those hormones. After the age of 20, we start to decline in our hormones, shockingly, but every year it gets worse and worse. So maybe we can talk about some symptoms that you might be having that might be related to your hormones, and maybe ones that you might not think about. I think a lot of people think about hot flashes, night sweats. We talk about low libido. Those are pretty common, and they do happen. They even happen before menopause, but a lot of people experience them during menopause. But some other signs and symptoms: irritability. If you're just getting, quick to anger, you get upset easily. That is something that I've had a lot of patients notice, and when they're on the hormones, they realize, wow, it's almost like an out-of-body experience, because you see yourself how you would have handled the situation and then how you're handling it now that you're on the hormones. Another one is mood swings, kind of goes along with irritability, where you're happy and then sad and then angry and then upset. And those are all things that can happen when your hormones are not optimized. Another one, muscle loss. So I think a lot of men might notice this more, but as you age, one, it's harder to gain muscle, but two, you're also losing all that muscle that you had in your 20s. And all of a sudden it's like, what? Not much has changed, but you realize that your hormones are decreasing, and that does cause muscle loss. Loss of interest in like your hobbies and activities. Maybe you used to love working out or going on bike rides or being more active, and now all of a sudden you just really have no interest in those things. That can be a sign that your hormones are lower than what they should be. Some others that I've personally experienced with some of my patients is insomnia. I had one patient who was just shocked how she hadn't been sleeping for 20, 30 plus years. And we got her started on hormones, and all of a sudden she was sleeping through the night, and she was able to go to sleep and not wake up multiple times. And she was just amazed and really didn't think that optimizing her hormones was going to be something that would help with that, but it did. Of course, hot flashes, night sweats, those are all things that resolve when we are able to optimize your hormones. Low libido, lots of our patients have talked about how their sex life has improved, and that's so important for a marriage. I can't reiterate that enough. Some other things that a lot of people have talked about: weight gain. As you age, we start to gain weight that's kind of unexplained, but it is from your hormones. Our hormones, when I take the blood work initially with patients, because that's what we always do, it's amazing to me and to my patients to see that like their testosterone is less than 5. When optimally it should be between 100 and 150. Their estrogen levels have just tanked, and we want those around 50 to 100. So, and this is with men and women. So really there's nobody that's out of the dark with this. A lot of times when you go to your primary care doctor and you talk to them about these concerns, they will just say, well, yeah, that's just part of aging. And as we know it, it is, but it doesn't have to be. So let me know if you have any questions. You can always go onto our website and book a consult, and we can talk more about it in detail and see if BHRT is right for you. Be sure to like, subscribe, and share this video, and we hope to see you at AIYANA soon.